as the federal shutdown continues, we are having a fight about Affordable Care Act tax credits and who should benefit from affordable health care. It's a fight we've been engaged in for over a decade, but this is a moment that is really urgent and imperative, and what the Democrats are asking Republicans to come to the table over. Because it's urgent, health insurance companies across this country and here in Maryland have already sent out their notices for January 1st plans. Those notices were sent on October 1st. And today's conversation is actually going to be more than just about those ACA tax credits, but what they mean for the whole system and what we are fighting for. And I'm bringing to you in today's Conversations with Your Congresswoman an or the expert on ACA. I'm so thrilled to be joined by Chiquita Brooks LaSure, who was the administrator for the Centers for Medicare and Medicaid Services under the Biden administration. I wanted to get that correct because was an important job, and this is a really important conversation. Thank you so much for joining me. My first question is, when you were in the Biden administration, helped to enroll over 100 million people in the Affordable Care Act or Medicaid. And by doing that, you helped achieve the lowest uninsured rate in U.S. history. What do these programs mean for the families who rely on them? And why is that uninsured rate really important for everybody's healthcare?
Well, thank you so much for having this conversation. It is so important. And I am so proud of what we were able to achieve during the Biden administration. I actually have the ACA behind me. I was part of the Obama administration, and I really think that during the Biden years, we were able to achieve so much of the promise of the ACA, which changed people's lives. And just a couple of the ways that Medicaid and ACA coverage have made such a difference for people is really being able to make sure that they were able to start their own businesses. I talked to a couple in North Carolina during my time who, they are job creators, right? Where the husband was a movie producer, and he and his wife, when they were able to get the advanced tax credits, the increased ones, they were able to get to afford their coverage, and both of them ended up having cancer during the course of the year unexpectedly, but they were able to receive treatment as a result of that.
Yeah.
So it's really given a lot of freedom to people who want to leave their employers and who are 50 to 65 years old, and so they know they're going to have healthcare needs, but want to start their own business. And I think it's so important to remember how many people, was just looking at the statistics, farmers, dentists,
right,
manicurists, people who do your nails. These are the people who rely on ACA coverage. And where we've been able to strengthen Medicaid over these years has made such a difference to a lot of not just low income and working families, but a lot of middle-class families. I think a lot of people don't know how many children who have special needs, and by special needs, I would say children with developmental disabilities, as well as those with physical issues. Over half of the organ transplants in this country, right, for children are often paid for by Medicaid. Here's what we're talking about when we talk about these programs. Most of the long-term care in our country is paid for by the Medicaid program. So it's important for all the people who are on it.
Yeah.
But even equally important is what it does for our healthcare system. And so the rural hospitals in this country are really supported by Medicaid and Medicare, but Medicaid in particular for so many places. And we've seen such a tremendous difference in states that have expanded versus those that have not. And part of that is when you have uncompensated care, people, delay care, they have more issues, but also sometimes hospitals can't stay open. They can't keep open their doors. And that ends up affecting all of us. And we're already starting to hear from places around the country about, I was just talking with folks in Georgia where a major hospital a rural hospital is closing its labor and delivery services. So, how devastating.
Yeah.
that is for communities. And it's, just it was really heartbreaking, honestly, to talk with some of the providers. Again, not just the people, but the providers who
Right.
just talk about how dedicated they are to trying to serve their communities, and what a difference Medicaid and ACA coverage make for them.
Well, I could talk about maternal and infant care all day because we are at almost crisis level in this country with, I think
Mhm.
is it 1/3 of communities in this country don't have
It's
a
crazy.
nearby OBG. I mean, it's really bad in terms of we want to be pro family in this country.
Mhm.
We have to literally start with that. So thank you for sharing that story from Georgia. And it's similar to stories all across here too. And we've been talking about the national number of folks who benefit from these ACA tax credits, but in Maryland, it's 190,000 Marylanders who are set to see their premiums go up on January 1st in Maryland by at least 13%.
Wow.
A question I got, we just did a town hall on Wednesday night, the first day of the shutdown. Why can't I vote for a week by week continuing resolution as we negotiate the ACA? Or why can't I wait for the 7 weeks of the continuing resolution that is in front of us right now? Why? And I've explained it, but I would love to hear your take on it. Why can't we wait 7 weeks to extend these tax credits? What is so urgent in this moment?
So the tax credits should have been extended months ago, because months ago is when the insurance companies figure out how much they're going to charge you next year. There are people who are getting notices this week and will, over the next couple of weeks, start to find out what their previous health plan, that the plan they're enrolled in, what the premium looks like. Open enrollment starts in just a couple of weeks. So we don't have 7 weeks for you all to negotiate a better deal. The people who are going to the website and starting to compare plans are going to see sticker shock. They'll have paid nothing or a couple of $100 and see that they are going to pay thousands of dollars more than what they expected to pay. And if you're on an income where you're talking about the different that $1,000 or a couple $1,000 is the difference about whether you can put food on the table, get your, drive to work, you're going to say, forget it. This is no longer a good deal. And we've seen, I mean, when I joined the administration, we had 12 million people enrolled in the Affordable Care Act marketplaces. We got to 24 million people. How did we do that? Part of it was these extended tax subsidies, which made such a difference to people. And I'll tell you just one story about what a difference. I was in I was in Delaware, the neighboring state, right after the tax credits were extended, where they were bumped up.
Mhm.
And I heard from someone who was sharing how her premium went down $70, and she had just gone to the doctor, found out her diabetes medications were $50 a month. So here, that difference in premium meant that she was able to actually get the care that she needed, which is the whole point of
Right.
insurance, right? So that you actually can pay for your medicines, can go see the doctor. And that's why it makes such a difference whether these subsidies are extended.
And it's not like if you don't have health insurance, you don't get sick.
Absolutely.
So really important to expand that coverage and expand that pool for everybody. I'm so grateful for you taking the time today. Thank you so much, Administrator. Thank you for your work under both the Obama and Biden administrations. Thank you for
Thank
your
you.
continued advocacy here. Something you said at the end, I think, is so important too. We're facing one of the greatest affordability crises in this
Mhm.
nation's history, and it's not just healthcare, which is what this moment in time is about. But as you said, it's housing, it's childcare, it's medications, it's at the gas pump, it's your energy bill. People cannot absorb this shock to the system that is coming on January 1st if Congress doesn't act and act now.
Mhm.
I'm back in my district today, as you can probably see by the autumn decorations behind me, but
Mhm.
I am set to drive to Washington the second the speaker calls us back to reach a bipartisan budget deal that includes the extension of these ACA tax credits. Because to your point, urgency is the word of the day, and
Mhm.
Thank you so much for taking the time. It's lovely to get to meet you. I hope I get to meet you in person someday. And thank you all. Thank you so much for your work.
Thank you. And again, thank you for educating people about what's happening. It's so important.
Thank you.